Hello and welcome to Care TV. You're tuned in with me, Amrit, and this is our beloved Dinah. Dinah is a nutritional medicinal practitioner from Vitamin Wellness Malaysia, and today she'll be sharing some tips on how we can create a new perspective on health. Why this is important is because in our previous episodes with Dinah, she spoke about how important it is to have and maintain a healthy lifestyle because of all the toxicity and all the problems that we're facing today. And today we're just going to delve deeper into that subject and talk about how it is that we can actually go about with creating that lifestyle and a change in perspective altogether. So with that in mind, let's ask Dinah, how do we create a new perspective on health?
In modern days approach, what should we do? Actually, we should take ownership of our health. That is being committed to, actually it's a personal approach where we should be committed towards managing our health. So in this sense, we should look at, instead of being curative, that is when the illness is already there in your body, we should actually look into preventive measures.
Okay.
How do we prevent illnesses from happening?
Okay, very good. So in essence, you're trying to say that before the disease manifests itself into the body, we should take care of it early on so that we're safe from it.
Yes. Isn't it will be easier to approach, instead when the illnesses, you already have illnesses like cancer, you have diabetes, you have heart disease, that is putting out the fire. Why don't we prevent it by changing our lifestyle? Yeah.
Dinah, what is a preventative lifestyle as opposed to a curative lifestyle? So what are some of the tips that you can provide to the viewers as to how we can do that?
Preventive, we call it preventive medicine, and it's also known as nutritional medicine. Basically, it's a very scientific-based approach, which has been thoroughly researched and is very well researched by peer-reviewed journals and all. Alright, and this, what happens is in this nutritional medicine approach, we look at the molecular level, alright, and in this sense, on the molecular level, what causes the degenerative of any diseases? What brings about the development of an illness? Yeah.
From the molecular perspective.
From the molecular perspective. From this perspective, each person basically have a different, we are genetically different. Yeah, even if we are from the same parents and whatnot, we are genetically different.
That's true.
It could be the genetic inheritance, or it could be a lifestyle issue that's affecting us. And lifestyle issue can be impacted by inwards and outwards environmental factors.
So you're saying that some factors are genetic and some are environmental?
Yes. Because of these two items, that is genetic and genetic, possibly we have inherited a weak genes from our parents, but because of lifestyle issue, it causes the degenerative of illnesses even faster.
So you're saying that despite having a weak gene, if our lifestyle is poor, it just makes that weak gene even weaker?
Yes, that's the point. Usually, the person would have a weaker gene. Let's say if the parents have a colon cancer, the father has a colon cancer, and if let's say the child would also inherit a weaker gene in the colon system. Yeah, and because of they don't manage their lifestyle, that means their food intake properly, it causes the onset, the cause, it actually hastens the development of having colon issues.
I understand it, but say someone has a genetic problem, right? If they have that genetic problem, is there a way, if their lifestyle is good, can you kind of put that genetic, that gene, that weak gene under control?
Oh yes, of course.
You can, right?
Yes, of course, through lifestyle change, why not? Because if, let's say, we know how to take care of our body and we know that we have a weak genes, we have a weak colon, tendency is, why don't we eat things that are beneficial to our to develop, to strengthen our colonic system. For instance, vitamin D. Vitamin D has known to be protective for our intestinal lining. And so isn't it like if we go out for morning sun, 10 minutes of morning sun, and then it will heal our intestinal lining?
Yeah.
Or it prevents degenerative of our intestinal
all that stuff.
lining?
Okay.
If a person has a high blood pressure, we want to bring down the pressure because it's an arteries issue.
Yeah.
So what we do is put them on very high magnesium diet. Yeah, and then in terms of food, they can take a lot of almonds. Almonds has lots of high in arginine.
Okay.
Arginine will soften the arteries.
Okay.